Good morning, everyone. Good morning. This is day 23 of the Dr. Joanne Lewis Foundation Heart Disease Awareness. And by popular demand, we are going to talk about sex and heart disease. I'm going to try to do this while I'm exercising, so I may be a little short-winded, but we have to try to get this video in for you real quick before we start off our day, okay? So you've been asking about sex and heart disease, and I have to tell you that based on information from Harvard, from NIH, from the American Heart Association, sex is generally safe for most people with stable heart disease. And the risk of a heart attack during sex is very low. Sexual activity is roughly equivalent to climbing 2 flights of stairs in terms of physical exertion. So there are benefits of sex for heart health. Sex is not only safe for most people with stable heart disease, it may actually be beneficial. Mild, moderate exercise it is equivalent to, because sex raises heart rate similarly to light aerobic activity. It can have positive effects to lower blood pressure. It shows to have a long-term association. It can help improve sleep, which supports cardiovascular health. It can help with stress reduction. Intimacy actually reduces cortisol and improves emotional well-being. There are some psychological and relation benefits. Stronger emotional connection reduces loneliness, depression, and anxiety, all which have been linked to higher heart disease risk. So there are some risks for people with heart disease, and this is when sex may be unsafe. Sexual activity should be avoided temporarily if you have what's called unstable angina, which is if you have chest pain at rest, severe or worsening heart failure, uncontrolled high blood pressure, recent heart attack without medical clearance, and symptoms during minimal exertion, like shortness of breath, chest pain, and palpitations. There are actual risks of heart attack during sex, extremely low, especially with a regular partner. Sexual activity accounts for less than 5% of angina episodes. It's actually called angina d'amour. There are some medication-related risks, such as erectile dysfunction, especially with drugs like Viagra, Cialis, etc. Cannot be combined with nitrates, okay? So if you're taking nitroglycerin, you should avoid drugs like Viagra and Cialis. This combination can cause dangerous blood pressure drops. So there are some sexual activity that are safest. Sexual activity varies in physical intensity. The goal is to minimize exertion and stress on the heart. The safest approaches are positions requiring less physical effort, partner on top for men with heart disease, or side-lying positions. Activities that allow pacing and rest, and avoiding sudden bursts of exertion. Have sex when rested, not immediately after heavy meals or alcohol. You should avoid high intensity or prolonged sexual activity if you are not yet cleared for moderate exercise. Positions requiring significant upper body exertion, like being on top if it causes symptoms. Sex in extreme temperatures, hot tubs, saunas, which can strain the heart. So a simple rule is if you can climb 2 flights of stairs without symptoms, you can usually have sex safely. There are some management strategies that you can use to reduce heart disease and improve sexual safety. But these strategies help you maintain a safe, satisfying sex life while protecting your heart. You should get a cardiovascular evaluation before resuming sex after a heart attack or new symptoms. Cardiac rehab improves exercise tolerance and sexual confidence. Should optimize your medications. Don't stop your heart medications because of sexual side effects. Just ask for alternatives. Treat erectile dysfunction safely. Avoid eating meds if on nitrates. Manage your blood pressure, diabetes, and cholesterol, which all affect sexual function. Should get regular moderate exercise, like walking and cycling, like what I'm doing now. Weight management. Quit smoking. Limit alcohol. Stress management. Breathing exercises, therapy, and mindfulness. There's some sexual specific strategies, like you choose a comfortable, familiar environment. You can start with cuddling and caressing and gradually increase activity. Communicate openly with your partner about your fears or symptoms. Stop immediately if you have chest pain, shortness of breath, dizziness, or palpitations. You need to know when to seek medical clearance before sex. You should talk to your clinician if you have new or worsening chest pain, shortness of breath with minimal activity, fainting or near fainting, irregular heartbeat, recent hospitalization for heart issues, or a new diagnosis of heart valve or disease or heart failure. So general rule to keep in mind, if you can climb up 2 flights of stairs without shortness of breath, you are okay to have sex. Sex is generally safe. So this concludes day 23 of the Dr. Joanne Lewis Foundation Heart Disease Awareness. We're gonna keep going. This is chapter 58. Chapter 58, people. Take care, have a blessed day. Love you all.